मोटा होगा, patient will be obese, but he may not have respiratory acidosis, right? So in obstructive sleep apnea, remember, PaCO2 will be normal. So this is how to solve this question. अब ये क्वेश्चन बार बार एग्जाम में आ रहा है एंड मोस्ट ऑफ द स्टूडेंट दे आर आंसरिंग इट ऑब्स्ट्रक्टिव स्लीप एपनिया. क्लियर? किस किस का सही है? ओके, नाउ मूविंग टू नेक्स्ट वन. Following is not a reversible cause of dementia. Now they are asking not. So कौन सा reversible cause नहीं है? Now try to understand this thing. So dementia can be reversible or it can be irreversible. So in simple, I can say dementia due to treatable cause. Dementia due to treatable cause is reversible. So which causes are treatable? So it could be due to any deficiency. Any deficiency means vitamin deficiency, thyroid deficiency. And dementia due to neurodegenerative disease. जहां पर भी न्यूरॉन्स का लॉस हो रहा है, wherever you see neuronal loss. So wherever you see neurodegeneration, that dementia will be irreversible. Clear? So let's try to understand this thing. Hypothyroidism, क्या ये ठीक हो सकता है? पेशेंट को आपको क्या देखना है? What you have to give levothyroxine tablet. So this is treatable cause. So this is reversible. Lewy body dementia. It is a neurodegenerative disease. This is irreversible. नॉर्मल प्रेशर हाइड्रोसेफेलस, अगर आप इसमें शंट लगाओगे, इफ यू प्लेस अ शंट, दिस इज ऑल्सो रिवर्सिबल. विटामिन B12 deficiency, you will give patient B12, this is reversible. Clear? Normal pressure hydrocephalus, patient is having more CSF. When patient is having more CSF, that is also reversible. तो आंसर क्या होगा? Lewy body dementia. Just I am writing what are the examples of irreversible dementia. Alzheimer disease, Parkinson disease, Huntington disease, dementia with Lewy body. Alzheimer, Parkinson, Huntington, dementia with Lewy body. So these are examples of irreversible dementia. And one more I can say, Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease. So these are irreversible. Simple concept याद रखना है आपको क्या? Dementia due to treatable causes, reversible. Again, they are asking you this a psychiatry medicine overlap MCQ. Done? अब थोड़ा डिफिकल्ट लेवल बढ़ा देते हैं. Try to answer. What is your answer? Again, question is very simple. What is the meaning of subclinical? Subclinical का मतलब क्या होता है? Subclinical means below the clinic. Patient clinic पे नहीं आया means patient is not having symptom. So subclinical myocarditis means उसको palpitation होगा. Palpitation is a symptom. ये तो नहीं होगा. Subclinical means patient is not having symptom but test will be positive. Test में कुछ ना कुछ आएगा. So myocarditis, so pro-BNP, troponin can be elevated. If you see, अगर myocarditis severe हो जाएगी, if it is severe, it can convert into heart failure. So heart failure, patient ejection fraction will be low. Myocarditis हो, pancreatitis हो, endocarditis हो, you will see, इसको बोलते हैं short में RWMA, region wall motion abnormalities. So 2D echo will have region wall motion abnormalities is also true. ECG will have, ECG is again a testing, तो ये भी सही है. So subclinical, this is the only hint in the MCQ. Subclinical means no symptom. Subclinical meaning is patient will not have any symptoms. So symptoms nahi hai, but findings will be positive. Findings means these findings will be in the ECG, in the echo, in the testing. समझ आया? Low left ventricular ejection fraction. देखो myocarditis हो, endocarditis, आगे जाके किस में convert होगा? It will convert into heart failure. Heart failure होगा तो patient ejection fraction will be reduced. Clear? So again, subclinical they are asking, subclinical में क्या नहीं होगा? Palpitation. So they're asking you correct statements. So B, C, D, E, these four are correct. So answer will be 4. Done? किस किसका सही हुआ है? Okay, now moving to next one. Again, INICET 22 question. Rejection of which of the following result in macrocytosis except. अब इसको समझते हैं. They're asking you कहाँ पर where you will not have macrocytic anemia. कहाँ पर macrocytic anemia नहीं होगा. So if you see ileum, ileum में क्या होगा? Ileum will have, ileum में क्या होता है? Absorption of B12. B12 का absorption होगा जैसा करें ileum. तो macrocytosis होगी. Yes. तो ileum की deficiency में macrocytic anemia होता है. Moving to jejunum. Jejunum will have folate deficiency. So folate deficiency again will have macrocytic anemia. That is not the answer. So the purpose of this class is not to like demotivate you. The purpose is to solve the difficult question. यहाँ से एक approach मिलेगा कि कैसे आपको eliminate करना option को. Now दो options you have eliminated. Now moving to stomach and duodenum. Now see duodenum में किसका absorption होता है? And iron deficiency is microcytic. Clear? Now coming to stomach. Stomach में B12, B9 iron का absorption नहीं होता. But stomach will produce intrinsic factor, and this intrinsic factor will take B12 where? To ileum for absorption. समझ आया? So अगर stomach आपने निकाल दिया, if you have removed the stomach, no intrinsic factor, it means there will be again no one will take B12 to ileum. तो stomach, ileum, jejunum को अगर आप रिजेक्ट करोगे तो मैक्रोसाइटिक अनीमिया होगा. डुडेनम को करने से नहीं होगा. So if you reject the duodenum, it will cause iron deficiency. Jejunum the answer. Answer will be duodenum. Clear? Answer will be duodenum. Am I clear? So duodenum will have which deficiency? Iron deficiency. Okay, now come. Sometime they will ask you this EEG pattern, and sometime they ask you like, what are the different waves that we see in EEG? बताओ क्या आंसर होगा? ओके मुझे बताओ हेपेटिक एन्सेफेलोपैथी में कैसी वेव मिलती है? EEG पैटर्न. व्हाट वी कॉल देम? तीन अलग अलग वेव दिखेंगी. दैट इज कॉल्ड ट्राइफेजिक वेव. Triphasic waves. Creutzfeldt-Jakob disease. What you will see? Periodic sharp wave. हमने main notes में, in our main notes we have written in a box all the EEG findings. Absent seizures. Absent seizures will have कौन सी मिलेगी? 2 to 4 hertz. 2 to 4 hertz. What we call them? Spike and dome pattern. Typical absence में क्या मिलता है? 2 to 4 hertz. Atypical absence less than 2.5 hertz. So mostly in MCQ, if nothing is given, it means they are asking about typical absence. Typical absence 2 to 4 hertz. Herpes encephalitis, what you will get? Blood. Periodic lateralized epileptiform discharge. Now see, look at the question carefully. अब absence seizures में 2 to 4 hertz के मिलते हैं. तो यहाँ पर कहीं पर भी hertz mention नहीं है. तो absence will not be the answer. Simple logic. अगर absence seizure होता, then frequency could have mentioned. Now, triphasic wave, you have to see three wave. Can you see any three wave? No. We are seeing only one wave. So there are no three abnormal wave ruled out. Now see, herpes encephalitis will have lateral size epileptiform discharge. Lateral side means there will be cluster of groups on this side of table. There is nothing here. So you can see एक बीच में एक projection आ रहा है. This projection is called periodic sharp waves. If you see, this is highlighted. This is called periodically. You can see a sharp wave. This periodically sharp wave is called as, it is seen where? In Creutzfeldt-Jakob disease. So sometime when you get a difficult question, try to eliminate other options. कोशिश करो to eliminate other options. So answer will be Creutzfeldt-Jakob disease. Okay, moving to next. बताओ. Patient with abdominal pain came to OPD with right upper quadrant pain. Right upper quadrant में pain हो रहा है. LFT report suggestive for mild increase in bilirubin. Right upper quadrant pain, it means hepatitis है. Bilirubin बढ़ा हुआ, bilirubin is increased, but liver enzymes are normal. Anti-HBs antibody is positive. Anti-HBs antibody is positive. Other parameters are negative. What is the diagnosis? Okay, मैंने बताया था SCCES. So what is positive here? Anti-HBs antibody is positive. So generally it is positive when infection is cured. तो cure तो option में नहीं है. Window period will have only IgM positive. Acute hepatitis में क्या positive होगा? HBs antigen and IgM. So again that is not the answer. Chronic will have IgG positive. So अगर ये positive है इसका मतलब patient को पहले कभी क्या हुआ है? हुआ था. That means either it is cured or patient had infection in the past. So answer will be D. Okay, moving to next. अब इसको पहले खुद कोशिश करो. Try to answer this. सब अपने अपने आंसर बताओ इसमें क्या आंसर होगा. Question number 7. What will be the answer? बताओ क्या होगा आंसर. पहले क्वेश्चन को ध्यान से पढ़ो. फर्स्ट लाइन में ही हिंट है. फर्स्ट लाइन इज हैविंग हिंट. 26-year-old फीमेल. 26 साल की फीमेल है. तो फीमेल है विथ ब्लीडिंग डिसऑर्डर. इफ यू हैव केयरफुली स्टडीड पैथोलॉजी देन सी हीमोफिलिया ए एंड हीमोफिलिया बी को क्या बोलते हैं. हीमोफिलिया बी इज कॉल्ड क्रिसमस डिसीज. हीमोफिलिया ए इज कॉल्ड क्लासिकल हीमोफिलिया. ये दोनों कैसे होते हैं. एक्स लिंक डोमिनेंट. तो दीज टू आर रूल्ड आउट because X-linked dominant, sorry, X-linked recessive. X-linked recessive, so these will be seen only in boys. Clear? Hemophilia C, क्या बोलते हैं इसका नाम क्या होता है. Rosenthal syndrome. Rosenthal syndrome, if you see, this is autosomal recessive, and von Willebrand disease is autosomal dominant. So आपने दो ऑप्शन एलिमिनेट कर लिए. अब आंसर क्या होगा. Either it is A or D. Now let's see the question again. 26-year-old female with bleeding disorder give history of father and sister having bleeding disorder. So I need to create a pedigree here. This is mother, this is father, and these are, suppose, this is our patient. Let me say this is our patient, right? Now you can see sister is having same disorder, so sister is having. Clear? Then what you can see father is having. Father को भी है. Am I right? ये हमारा patient है. I am writing a P here. Patient की पापा को है और बहन को है. It means you can see all generation are affected. It means it's a dominant disease. And which among this is dominant? A. So answer will be von Willebrand disease. This question came in your exam. ये आपके एग्जाम में आया हुआ question. Is it clear? So try to understand. Medicine question will not be easy. Sometimes you know everything, but still we confuse. Moving to next. Try to answer. What do you think? क्या होगा answer? What do you think? Farmer age 60 year. एक farmer है उसकी age 60 साल है. Fever, body ache and cough. बुखार आ रहा है, body pain हो रहा है, खांसी हो रही है. एक black spot है chest में. IgM for scrub typhus positive. So it's clear. It is a diagnosis given. So what is another name of scrub typhus? Anyone? Another name of scrub typhus. क्या बोलते हैं उसको? Microbiology. Susugamushi fever. It is a patient with Susugamushi fever. Susugamushi fever है patient को. Now they are asking you what is the treatment. तो देखो पहले हम इसको treat करने के लिए doxycycline देते थे. Then later on, due to emerging resistance, we started giving azithromycin. But in old age people with comorbidities, we give both drugs. So you can see first trend is old 60-year-old and patient is having fever, body ache and cough symptom भी है और एक black scar है. So we have to give dual drugs. So in old people, we have to give combination of क्या दोगे अब डॉक्सी अलोन डॉक्सी एजिथ्रो सेफ्ट्राक्सोन डॉक्सी. तो देखो डॉक्सी अलोन नहीं देंगे सेफ्ट्राक्सोन अलोन नहीं देंगे तो व्हाट वी गिव कॉम्बिनेशन ऑफ डॉक्सी एंड एजिथ्रो. So this will like patient we have to give treat two drugs for 5 days. Young hoga then we give only azithromycin for 5 days. 500 mg OD for 5 days. Only azithromycin 500 mg OD for 5 days or clarithromycin 250 BD for 5 days. Okay, अब बताओ 75-year-old patient. Patient look at the age 75 year with CHF. Again, I am trying to highlight the hint for you. Patient की age कितनी है 75 and try to make your diagnosis in one go. 75-year-old patient, heart failure है, cardiac enlargement. So more likely chance patient को DCMP हुआ और DCMP के बाद क्या हो गया CHF. Clear? So we made a diagnosis. Cardiac enlargement means dilated cardiomyopathy हुई. Now he is having heart failure. Now they are asking you which drug will decrease mortality and reduce further enlargement. Now understand? Now if you see these patients, if you see this patient, I told you there are total 4 drugs which are having mortality benefit. So first is ARNI, then what we have? ACE inhibitor, ARBs, and beta blocker if patient is having MI. Clear? And last one which is having mortality benefit will be anyone? SGLT2 inhibitor. So these are the drugs which are having mortality benefit. Digoxin का mortality benefit नहीं है. Furosemide का mortality benefit नहीं है. अगर same question if they are asking you like which drug is used to treat acute heart failure, then diagnosis will be furosemide. Now you should be confused between C and D. So in some apps, the answer for this question is given carvedilol. In some app, you will see answer is given captopril. Now look at the question carefully. Patient को DCMP के बाद हुआ है, तो beta blocker is not the answer. Second reason for not having beta blocker is carvedilol is not just a beta blocker, it is alpha plus beta blocker. Is it clear? So answer क्या होगा इसका? Captopril. But again, captopril भी practice में उतना use नहीं करते हैं. So answer for this question should be ramipril. Is it clear? So captopril again we don't use, but MCQ तो आपको solve करना है. So these are the drugs which you have to remember. These drugs they have mortality benefit. If question में अगर ऐसा होता patient को MI हुआ है, then answer will be carvedilol. And again, better answer than carvedilol should be metoprolol. Bisoprolol means cardioselective. Then better answer should be cardioselective beta blocker. Okay, try to answer next one. 40-year-old person with markedly elevated creatinine levels. तो फर्स्ट हिंट MCQ is young person है, क्या बढ़ा हुआ है? Creatinine. Creatinine is increased, it means patient is having some kidney damage. Diagnosed with post-immune RPGN. ये हमने पढ़ा था? नहीं पढ़ा था? Post-immune RPGN. Nephritic nephropathy we have not studied. पढ़ा था? नहीं पढ़ा. Okay, so understand this thing. Pathology में पढ़ा होगा. तो RPGN will have 3 types of deposits. See, so we have linear deposit, we have granular deposit, and we have post-immune. So sometimes you will see deposits, they are in the line. It is called as linear deposit. So RPGN actually hota kya, understand this? RPGN is not a disease. RPGN is a complication of other nephritic syndrome. So if you see एक deposit एक line में हो रहे हैं, we call this linear deposit. If you see deposits are in the form of granules, we call this granular deposit. So try to understand this thing. RPGN is a complication which can occur after any nephritic syndrome. तो अगर linear deposit मिल रहे हैं, if you are seeing linear deposit, it means good pasture is converting into RPGN. If you see granular deposit, it means PSGN, Alpert, IgA nephropathy. Then what we have? We have lupus nephritis or SLE nephritis and MPGN. Means बाकी सारी all other nephritic syndrome if they are converting, इसको बोलते हैं granular deposit. You did biopsy and you found nothing. Biopsy is normal. कुछ deposit नहीं मिले. That is called post-immune. So what is the meaning of post-immune? A non-kidney disease is converting into kidney disease और RPGN. इसका मतलब ये किडनी की बीमारी नहीं थी, तो क्या कन्वर्ट होगा? Vasculitis. When any vasculitis will convert into RPGN, that is called post-immune. So which vasculitis can convert into RPGN? Wegener's granulomatosis, microscopic polyangiitis, polyarteritis nodosa. So these are vasculitis which can convert into RPGN. अब देखो क्वेश्चन, post-immune. So post-immune अब देखो, anti-PLA2, where we see anti-PLA2, कहाँ मिलता है? Anti-PLA2 where we see? It is seen in MGN. MGN तो nephrotic होता है. So MGN will not convert into RPGN. Atypical ANCA you will see in many cases. So again you will not see here. Anti-GBM किसमें convert होता है? Anti-GBM seen where? In good pasture. So it will have linear deposit. Now Wegener's will have C ANCA and microscopic polyangiitis will have P ANCA. So answer will be B. Is it clear? See, Wegener's will have C ANCA and microscopic polyangiitis will have P ANCA. और पान में अंका नहीं होता, पान में क्या होता है? इम्यून कॉम्प्लेक्स. पान will have immune complex. Am I clear? So answer for this will be अंका. Okay, next question. Try to answer. Try to answer. तुम बताओ. Again, in any pneumonia question, I told you first of all we have to calculate curve 65 score. अब इस क्वेश्चन में curve 65 score निकालेंगे नहीं निकालेंगे? Tell me. Will you calculate curve 65 score or not? Why we calculate curve 65 score? Two. So it's already written patient shifted to ICU. So there is no need to calculate curve 65 score. So don't waste your time in calculating curve 65 score. एक बार क्वेश्चन पढ़ लो. A patient ICU में simple. The patient is having following parameters. Creatinine is 1.5, means some kidney involvement. BUN is 45. X-ray is given. Then you can see rhinovirus. So you can see here again some atypical infiltrate, means some interstitial infiltrate. Patient को ICU में shift कर दिया. I told you the management. याद आ रहा है? How you will treat the patient? In OPD, IPD. तो IPD में मैंने क्या बताया था? We give two drugs. कौन कौन से? So we give tablet of azithromycin and injection of beta lactams, right? So beta lactam कैसे देंगे? IV. How we give? Oral. Am I clear? In ICU we will always give two drugs. If patient is resistant or allergic to any of these, then what we give? Then we give IV respiratory fluoroquinolone, means moxifloxacin. ये लिखा था हमने, याद आ रहा है? So pneumonia treatment will be either combination of beta lactam plus cephalosporin. अगर पेशेंट इन दोनों से एलर्जिक है या रेजिस्टेंट है, then we give respiratory fluoroquinolone, that is moxifloxacin. So azithromycin alone, no. Amoxicillin plus clavulanic acid, no. Piptas is piperacillin tazobactam, ये दोनों combination? No. So what we give? Ceftriaxone plus azithromycin. Easy था? Done. Okay, let me see. Some doubts are here. यहाँ तो कोई आया नहीं. Okay, moving to next one. Any doubt to anyone online? Seeing you can ask your doubt in the comment box. Belimumab, बताओ. How you will give belimumab? What is the mechanism of action? बताओ. What do you think? Okay, what do you know about JAK1, JAK3 inhibitor? ये कौन सा है? Where we give JAK1, JAK3? Tofectinib. And where we use this? RA. It is used in rheumatoid arthritis. तुम बताओ. Anti-CD20. It's very common used drug. Rituximab. कहाँ कहाँ पढ़ा था rituximab? You have studied in different places, many places. We have studied rituximab. एंटी कैंसर है लेकिन कहाँ पढ़ा था? Non-Hodgkin. Non-Hodgkin lymphoma, and we use this in many tumors. TNF inhibitors. So these are like many different drugs. Abatacept, etanercept, infliximab, right? So these are also used in rheumatoid arthritis. Anti-TNF के कई सारे ड्रग होते हैं. Etanercept, abatacept, infliximab. Now what is last? BAFF inhibitor. BAFF inhibitor is belimumab, and remember this is approved for treating SLE. Even nowadays they're asking you expected question, which is BRAF inhibitor. Which is BRAF inhibitor. So BRAF is a gene that is involved in different leukemias, different cancer like hairy cell leukemia, melanoma of skin, right? BRAF is involved in, I can say, some Langerhans cell disorders. So BRAF को inhibit करने की आप, you can target many cancer. What is the example? Anyone? BRAF inhibitor. Vemurafenib. So BRAF inhibitor is Vemurafenib. None? Okay, moving to next. Most common liver abnormality in patient with sarcoidosis. बताओ. Most common liver abnormalities in patient with sarcoidosis. Sarcoidosis के patient को hepatomegaly होगी. Hepatomegaly you can see in any patient. Cirrhosis you will not see all patient because sarcoidosis mainly it will affect lungs, and after lungs it will affect uvea. So these are two commonly involved organ, lungs, uvea. Clear? So liver को cirrhosis नहीं होता हर patient को. Now understand, in sarcoidosis hepatocyte की death नहीं होती तो AST भी नहीं बढ़ते. But sarcoidosis can involve your bile duct. Bile duct involve होगा तो क्या बढ़ेगा? ALP. The most common change is like people will have high value of ALP. We call this asymptomatic cholestasis. So patient is having cholestasis and this is one of the earliest change. Done? So increase in ALP is one of the earliest change that we see in a patient of sarcoidosis. Okay, moving to which of the following condition can mimic asthma? So for this, before seeing the option, I should know in my brain what are the symptoms of asthma. So tell me, what are the symptoms of asthma? What do you think? What will be symptom of asthma? Asthma means patient will have shortness of breath. Then patient will have cough. What else? Dyspnea, shortness of breath, same thing. What else? Then patient will have cough, shortness of breath. You can see patient because of histamine release. Skin will be red in color. What do we call this? Flushing of skin. flushing or hyperemia of skin. What else? और क्या होगा? Then patient will be sitting in this kind of position. ऐसे झुक के बैठा रहेगा, right? So you can see we call this tripod posture. So mainly symptoms are cough, flushing, shortness of breath, and खांसी होगी because it's an obstructive disease. So patient on auscultation he will have wheeze. So these are the general symptom of asthma. Now we need to see can any other disease will have this congestive heart failure. Heart failure patient की सांस फूलती है, फूलती है. Earliest symptom is fatigue, dyspnea, PND. हमने लिखा था. Heart failure symptom patient will have PND. PND means paroxysmal nocturnal dyspnea. So this is seen, yes. So this can mimic asthma. GERD, gastroesophageal reflux disease. इसमें खांसी हो सकती है. Yes. It can also have cough. Exercise induced dyspnea. Again, dyspnea there, it means it is mimicking asthma. Cystic fibrosis. Patient will have mucus plugging. Mucus plugging की वजह से क्या होगा? Shortness of breath, cough. Answer will be simple. All all can mimic asthma. तो क्वेश्चन उतना डिफिकल्ट नहीं है जितना दिख रहा है. All these disease. किसने लाइक आंसर में ए सी डी मार्क किया था? एसीडी लिखा ऑप्शन में नहीं है. लाइक अगर आपको जीआरडी में डाउट है तो एसीडी ऑप्शन में नहीं है. तो सिस्टिक फाइब्रोसिस विल हैव म्यूकस प्लगिंग. सो ऑल दीज डिसीज कैन मिमिक अस्थमा. डन. ओके, ट्राई टू आंसर नेक्स्ट वन. तुम बताओ, बताओ, ट्राई टू आंसर. क्यों? ओके. 24-year-old patient present with persistent hyperglycemia मीन शुगर बढ़ा हुआ है. लैक एविडेंस ऑफ ऑटो इम्यूनिटी. ऑटो इम्यूनिटी नहीं है इसका मतलब टाइप 1 नहीं है, राइट? Type 1 will have antibodies. 1.5 will also have antibody. समझ आया नहीं आया? तो क्वेश्चन इज गिविंग यू हिंट. ऑटोइम्यूनिटी नहीं है. फैमिली हिस्ट्री रिवील्स द lineage affected by diabetes across several generation. Pattern of dominant genetic transmission. It means they are telling you, these two lines are telling you there is no skipping. No skipping means दादा को है, पापा को है, बेटे को है, उसके बेटे को है, right? It means there is no skipping means all generation are affected. So this is the classical feature of Modi. And LADA, understand, LADA is seen generally after 30s. Patient is young. And LADA will not have dominant type of inheritance. So Modi, remember, Modi is something. This Modi will have no skipping means it will affect all generations. So you will see a dominant type of inheritance. Means Dada's brother sister will have someone, father brother sister will have someone, and your brother sister will have someone. That is called a pattern of Modi. Done? Okay, moving to next. Try to answer. Okay, try to answer next one. 66-year-old patient present with sudden onset chest pain after a stressful event, resembling symptom of heart attack. Subsequent examination reveals transient left ventricular dysfunction and with apical ballooning. Try to answer. आप बताओ. Why C? The first hint in the MCQ is patient is having some stressful event. Stressful event means there is trigger. Stress can release catecholamines, norepinephrine, epinephrine. Then there is apical ballooning on imaging, means this will have this type of pattern, what we call as octopus jar heart. And disease is mimicking like heart attack, means it mimic like MI. So इसमें MI जैसा क्या होगा? ECG changes, MI like troponin elevation. It's the classical case of Takotsubo cardiomyopathy. Restrictive cardiomyopathy will have long-term history of cancer that can convert into amyloidosis. ARVD and Yamaguchi, they are rare condition and not related to stress. So it's a case patient of Takotsubo cardiomyopathy. Clear? Okay, try to answer. Patient develop a UTI which get complicated with hypotension that is resistant to IV fluid. Why? Hypotension is resistant to IV fluid. It is not telling you patient is resistant to antibiotic. हाइपोटेंशन आईवी फ्लूइड से रेजिस्टेंट है, मीन्स उसका बीपी नहीं बढ़ रहा है आईवी फ्लूइड देने के बाद, तो क्या दोगे? इफ बीपी इज नॉट इंक्रीजिंग देन वी विल स्टार्ट inotrops. Simple. Inotrops means you will give norepinephrine to increase his BP. We will give epinephrine. Hypotensive shock में patient, so you can use inotrops for hypotension. Now what is the answer? बताओ. Patient को UTI है, which drug you will use? बताओ. Nitrofurantoin. Why? Normally in UTI what we give? In normal UTI, what we give? We give nitrofurantoin, we give fluoroquinolones. Means ciprofloxacin, levofloxacin, ofloxacin. But remember, there is a term called complicated UTI. Complicated UTI means UTI when it become complicated, like UTI in diabetes patient, UTI even in males patient, UTI in any patient who is having a catheter, UTI in pregnancy. देखो, पेशेंट अगर प्रेग्नेंट है, डायबिटिक है, मेल है, दैट्स कॉल्ड कॉम्प्लिकेटेड यूटीआई. इन कॉम्प्लिकेटेड यूटीआई नाइट्रोफुरेंटोइन विल नॉट वर्क, सिंपल सेफ्ट्रैक्शन विल नॉट वर्क, एमॉक्सिलिन विल नॉट वर्क. तो आंसर तुम्हारा सही था बट तुक्का था. सो योर आंसर वाज करेक्ट. सो अंडरस्टैंड दिस थिंग. इन कॉम्प्लिकेटेड यूटीआई व्हाट वी गिव पिपरासिलिन टैजोबैक्ट. भी मैंने नहीं दिया, इसमें दिया है ऐप में. तो मैं देख लूं. विच वन इज क्वेश्चन नंबर 17? नहीं, मैंने तो ये दिया आंसर. वो गलत हो गया है. ओके. यही दिया है. तुम्हारा कौन सा ऐप है फिर? ओके, सो अंडरस्टैंड. इजी वन. तुम बताओ. ट्राई टू आंसर. डू द कैलकुलेशन. 145 माइनस 145 माइनस, so it is 35. So value is more than 12. So what we call this? Nagma or Hagma? Hagma. High anion gap metabolic acidosis. So answer is 35. Simple. Sometimes they can ask you to make simple calculation. anion gap कैसे निकालते हैं? सोडियम माइनस नेगेटिव आयन. Sodium minus sum of negative ions. So this is the formula that you should remember. Sodium minus sum of negative ions. Am I clear? This is the formula that you should remember. Okay, moving to next one. Try to answer. Your turn. बताओ. क्या आंसर होगा? Okay, so let's see. A chronic cigarette smoker now joined a construction company. So her answer she is telling construction company दिया है इसलिए restrictive lung disease, right? But ये cigarette smoker भी दिया है, so it could be obstructive lung disease. Pulmonary function tests are given below. Then you can see initial lung volumes are FEV1 0.9 liter, FPC 1.9 liter, ratio is 0.4. After bronchodilator, FEV1 1.9 liter, FVC 3.9, FEV1 FVC ratio 0.4. तो मैंने आपको क्या बताया था, like to rule out obstructive lung disease, what we do spirometry and pre and post bronchodilator. याद आ रहा है कुछ? तो आप पहले normally first you will do spirometry normally, then you will nebulize the patient with salbutamol or albuterol. आप पेशेंट को नेबुलाइज करोगे विद salbutamol albuterol. After nebulization, what I told, if FEV1 increase by how much? More than 12% or 200 ml. अगर बढ़ गया, then what it is? Then it is asthma. If not, then it is COPD. Right? तो आपको पूरे इतने बड़े क्वेश्चन में, दिस बिगर क्वेश्चन, व्हाट यू हैव टू सी? FEV1. तो लेट्स सी, पहले FEV1 कितना दिया? 0.9, राइट? बाद में कितना दिया? 1.9. कितना बढ़ गया? 0.9 लीटर से 1.9 लीटर मीन्स कितना बढ़ गया? 1 लीटर. 1 लीटर, is it more than 200 ml? Of course. What is the answer now? बताओ अब, कहाँ गलती हो गई? Silly mistake. Okay, now see, is it a vascular disease? No. Is it restrictive lung disease? No. It is obstructive lung disease with bronchodilator reversibility. It means it is asthma. समझ आया? Silly mistake. तो क्वेश्चन को पूरा पढ़ना है, जस्ट कंस्ट्रक्शन कंपनी देख के रेस्ट्रिक्टिव लंग डिसीज नहीं, राइट? और देखो ध्यान से, इफ यू यूज सम लॉजिक, रेस्ट्रिक्टिव लंग डिसीज में ब्रोंकोडायलेटर देने से कुछ फर्क नहीं पड़ता. There is no effect on bronchodilator because that is due to inhaled particles, coal dust, silica dust, or bagage, moulash, cotton dust. So dust particles, once they are inside, so that will not change after giving bronchodilator. Is it clear? तो अगर FEV1 FPC में डिफरेंस दिया, इट मीन्स यू नीड टू थिंक इट इज सम ऑब्स्ट्रक्टिव लंग डिसीज, या तो COPD होगा या अस्थमा. दिस इज वेरी वेरी इंपॉर्टेंट, बार बार क्वेश्चन आ रहा है. ओके, मूविंग टू नेक्स्ट. दिस वन इज इजी. Easy. Okay, they're asking you correct statement. Skip lesions are present in Crohn's disease, true or false? This is true statement, so this is the correct answer. Mucosal layers are involved in Crohn's disease, while transmural, this is false. उल्टा लिख दिया, उल्टा लिख दिया. Transmural is seen in Crohn's. Inflammatory bowel disease have strong 9.34 genetic predisposition. No, it's having hardly 1 to 3%. 9.4. This is also false statement. Crohn is curable. Ulcerative colitis can be curable if you remove colon and rectum. Crohn disease can involve any part, so it is not curable. Answer will be A. ये तो easy है. Next one for you. You have to tell me the diagnosis. तुम आंसर छोड़ो, diagnose बताओ. Just tell me the diagnosis. What? So it's a PSM overlap with medicine. पेशेंट को क्या हो रहा है? फीवर है, chills. Fever profile is order. Fever profile में क्या क्या आता है? What we have in fever profile? If you go to Safdarjung OPD or AIMS OPD, you will see fever profile. Fever profile means normal disease which cause fever. Like एक मलेरिया का टेस्ट कराते हैं, typhoid. These two are common. And sometimes it's seasonal disease, like in rainy season. We also check for dengue. So malaria, typhoid, dengue, these are common disease which can cause fever. So malaria, dengue कैसा आ गया? Negative. But RK39, this is the hint. So आपसे it's actually a PSM question. They are asking you RK39 test किसके लिए करते हैं? किसके लिए करते हैं? काला अज़हर. So diagnosis for this patient will be काला अज़हर. So काला अज़हर, they ask you what is the treatment of choice. Now, lamb. So treatment of choice will be lamb. Lamb means liposomated amphotericin B. Dapsone we don't use. Dapsone is given only in two conditions. कहाँ पर dapsone देते हैं? Leprosy and dermatitis herpetiformis. Hydroxychloroquine is a non-specific drug. Basically इसको कब देते हैं? Whenever arthritis in rheumatological condition like SLE arthritis, Sjogren syndrome के arthritis हो गए. So arthritis और photosensitivity को ठीक करने के लिए देते हैं. Clear? So answer is LAMB means liposomated amphotericin B. Okay, suppose if they ask you what is oral drug that we use, LAMB is given IV. और याद रखना LAMB को देने से पहले what we do? LAMB is a nephrotoxic drug. So LAMB को देने से पहले क्या चेक करोगे आप? Kidney function test means we need to check patient serum creatinine. अगर creatinine बढ़ा हुआ है तो avoid करते हैं LAMB देना. If it's unavoidable, then we give 2 bolus of IV fluid. Clear? So a KFT, a serum creatinine is must. Oral drug of choice for Kala Azar. Anyone? Oral drug of choice. IV drug of choice is lamb. Overall drug of choice is lamb. Your answer is correct. But I'm asking some extra thing. ये भी question आ चुका है आपके एग्जाम में. Miltefosine. Miltefosine is oral drug of choice that we use for Kala Azar. Then Miltefosine. Okay, next. Try to answer. Following drug is not used for the immediate management of hyperkalemia. Hyperkalemia means potassium बढ़ा हुआ है. What you will not use? 10% calcium gluconate दोगे? Hyperkalemia. Do we use this? Yes, so it is given. Salbutamol देते हैं? देते हैं. Salbutamol will send potassium back to cells. Salbutamol देते हैं. Dextrose insulin देते हैं. Insulin देते हैं. Insulin and salbutamol, they both will send potassium back to cells. बट इंसुलिन हाइपोग्लाइसीमिया कर सकती है, इसलिए साथ में क्या देते हैं? डेक्सट्रोज. MgSO4 नहीं देते. Am I clear? So in hyperkalemia, what we give? Just I'm writing here. Suppose if you are having a patient who is having hyperkalemia, so what all drugs we give? The first thing is what we give? Calcium gluconate. Second is what we give? We give salbutamol and insulin. They both have similar action. They will send potassium back to cells. What else we give? और क्या देते हैं? Binders. K binders. K binders means So we have pyromer, sodium polystyrene sulfonate, sodium zirconate. These are potassium binders. और क्या देते हैं? और कुछ? हाइपरकैलेमिया, पोटेशियम ज्यादा है, NS दे दो, fluid. Fluid will dilute this. IV fluid means NS we can use. And last option, if nothing work, then patient will need dialysis. So these are the treatment option available for hyperkalemia. Done. Okay, next one is easy. Again, बड़ा लग रहा है लेकिन easy question है. Try to answer. What do you think? Chronic hepatitis B infection would be consistent with which of the following? तो पहले हम अपने बना के देखते हैं. What I told you in chronic. In chronic, I told you there should be entry. Entry means surface antigen. In chronic, what else I told you? There should be IgG anti HBC positive, right? And in chronic, like before starting treatment, what we need? HBV DNA. मैंने आपको बताया था, all patient you will not treat. You will treat only when viral copies are more than 20,000. Right? तो आपको DNA का टेस्ट कराना HBV DNA. So let's see the option. In chronic, surface antigen should be positive, yes. Anti-HBs antigen, no. ये तो cured हो जाएगा, or it could be like late remote infection. Anti-HBC we need, yes. But which anti-HBC we need? IgG. And HBV DNA we need, yes. So answer will be A, C, D. Or I can say, let's 1, 2, 3, 4. So it will be 1, 2, 4. 1, 3, 4. Sorry. Clear? So answer will be 1, 3, 4. तो हेपेटाइटिस से एक क्वेश्चन आता है बार बार फ्रॉम दिस मार्कर, वेरी इंपॉर्टेंट. ओके, मूविंग टू नेक्स्ट. पेशेंट प्रेजेंट विथ फीवर एंड न्यूकल रिजिडिटी. फीवर है, न्यूकल रिजिडिटी. Resident was instructed to perform a lumbar puncture. What is correct order of managing the patient? तो उसको अगेन 1, 2, 3, 4 कर लो. क्या होगा? परफॉर्म लंबर पंक्चर. बताओ क्या करोगे पहले. ओके, 1, 2, 4, 3. प्लेस कैनुला, गिव IV फ्लूइड, देन वी स्टार्ट इंजेक्शन. नो, पहले तो लंबर पंक्चर करोगे. आई टोल्ड यू फर्स्ट do lumbar puncture, then give antibiotic, because if you give antibiotic first, then culture report will be sterile. So first will be 4. Then what we will do? CSF sample भेज दो, right? Then what we have? Start injection ceftriaxone and continue IV fluid like at 40-50 ml per hour. 4, 3, 2, 1. So answer will be 4, 3, 2, 1. Again, ये लग रहा था बड़ा difficult question, but नहीं था. It was easy. Try to answer. Perioral numbness. Perioral numbness, tingling and tetany. So tell me first, what is the diagnosis? Hypocalcemia. So patient is having low calcium. Simple. Hypocalcemia में क्या होगा? Tetany होगी. So they are asking you all the following condition can lead to this except. Now let's see. Vitamin D toxicity means more vitamin D, it means more calcium. So vitamin D toxicity में क्या होगा? It will have hypercalcemia. Calcium बढ़ा हुआ आएगा. Acute pancreatitis can sometimes consume calcium, so patient can have hypocalcemia. CKD patient will have secondary hyperparathyroidism. So again, there can be hypocalcemia. And hypoparathyroidism will have less PTH. So again, there will be hypocalcemia. So answer for this will be vitamin D toxicity. Vitamin D toxicity में क्या होगा? Hypercalcemia. Okay, next one is easy. So try to answer. तुम बताओ. Thrombolysis can be considered in all the following condition except. बताओ. MRI showing density in less than 1/3 of area. यहाँ पर thrombolyze कर दोगे नहीं करोगे? करोगे नहीं करोगे? लेस पूछा है ना, कर दोगे? अगर 1/3 से ज्यादा होता, then you should avoid. It means there is cerebral edema. In that case, we should avoid. अगर कम दिया हुआ है तो कर दो thrombolysis. There is no issue. So here I will do thrombolysis. But it's not the answer. BP of more than 185 by 110. करेंगे नहीं करेंगे? BP should be less than this. BP should be less than this. आगे देखते हैं. Ischemic stroke within 2 hours. What is the window period? Window period should be 4.5 hours. तो यहाँ पे थ्रोम्बोलाइज करेंगे, कर देंगे. ऑनसेट ऑफ सिम्टम्स, ये कुछ मिसप्रिंट हो गया यहाँ पर. तो मिसप्रिंट हियर. दिस इज क्वेश्चन नंबर 26. क्वेश्चन नंबर 26. ऑनसेट ऑफ सिम्टम्स लेस देन 4 आ रहे हैं. और ये दूसरे क्वेश्चन के ऑप्शंस आ गए. क्लियर? तो क्वेश्चन इज thrombolysis can be considered in all the following condition except. So MRI is having density less than 1/3. So here we can do thrombolysis, right? Then you can see BP. BP, if it is more in this, thrombolysis avoided. So thrombolysis we will do whenever BP is less than this. So that's my answer will be B. अगर पेशेंट देखो ischemic stroke within 2 hours है या symptom onset is within 4 hours, तो अगेन दोनों क्या है, 4.5 घंटे के अंदर है. तो both are in the window period, so we can do thrombolysis. So in a nutshell, what we should remember, what are the indication of doing thrombolysis? बताओ क्या क्या indication है? When you will do thrombolysis. First indication is patient should come to you in less than 4.5 hours. Right? Onset से 4.5 घंटे में आना चाहिए. Next indication बताओ. BP. BP should be less than 185 by 110. In some books 100 is given. अब देखो यहाँ पर कितना दिया हुआ है, 185 by 110. कुछ कुछ लोगों का 105 106 आता है. Like again डेविडसन वगैरह में ये 110 दिया हुआ है. So let's say 110. What else? और क्या इंडिकेशन थी? और क्या इंडिकेशन मैंने लिखाया था, बताया था? एज एज कितनी होनी चाहिए पेशेंट की? एज शुड बी मोर देन 18 ईयर्स. छोटे बच्चों में नहीं करते थ्रोम्बोलाइसिस. एंड व्हाट एल्स आई टोल्ड यू, जस्ट रिमेंबर, एमसीए टेरिटरी विल इन्वॉल्व लेस देन 1/3. If there is MCA territory involved less than 1/3, you can see less than 1/3 means patient is having less edema. It means bleeding is not dispersed. So these are the indication where we do thrombolysis. At least remember this one, very very important, and this two. ये एग्जाम में दोनों आती हैं. BP कम और patient should come in less than 4.5 hours. Okay, so this one is easy. अब बताओ, what is the answer? कैसे कैसे solve करोगे? I will solve like this. Heart disease दिया है. These two are ruled out. Am I right? If heart disease is given, then MMRC is for lung disease. Heart disease है तो क्या होगा? NYHA. A patient is having breathlessness on going to bathroom. तो क्या होगा? Four क्या था? Rest. Four was at rest. So it is NYHA 3. Okay, what was NYHA 1, 2, 3, 4? बताओ. One क्या था? One means you can say strenuous or कैसी. After exercise or some activity means there is slight limitation, right? So in one you can say there is slight limitation. In two, there is a moderate limitation. And in three, there is you can say a marked limitation. Means less than ordinary activities can cause dyspnea. देखो वन में क्या होगा? Strenuous activity will cause symptom. Two में ordinary activity. Strenuous activity will cause symptom. In two, ordinary activity will cause symptom. In three, less than ordinary. And four, floor or at rest. So dyspnea at rest. So this will be NYHA 3. So again, exam is going clinical, so they can ask you question on NYHA or MMRC. Important. Okay, बताओ next one, 28. Try to answer. Diagnose बताओ क्या diagnose होगा? Erythematous lesion over exposed area of the skin, like arms, chest, arthralgia, breathlessness. So exposed area means there is some sort of photosensitivity. So there is some sort of photosensitivity. What else? Hint is given in the question. Arthralgia, then shortness of breath. Antihistone antibody किसके लिए करते हैं? So diagnosis is simple. So antihistone is for drug-induced lupus. Anti-dsDNA is to confirm. So it could be the answer. Anti-centromere is for CREST syndrome. ANA, these are sensitive. These are sensitive antibody but not specific. So confirm किससे करोगे? Anti-dsDNA. So they're asking you question. Question देखो same question. अगर मैं ऐसे पूछता, which of the following antibodies used in screening? For screening, then answer should be ANA. But they're asking you confirmation. dsDNA अगर ऑप्शन में एक और कुछ होता, anti-Smith. So anti-Smith, anti-dsDNA, they are for confirmation. Okay, try to answer. What do you think? Severe vomiting was treated for dehydration outside the hospital. What do you think? क्या होगा आंसर? I told you something like rate of correction of sodium should not be more than 10 to 12 milliequivalent per day. अगर आप जल्दी correction करोगे, what we call this? Rapid correction of hyponatremia. Rapid correction of hyponatremia. This will cause a condition. That condition is called OATS. What is OATS? Osmotic demyelination syndrome, and it can progress into central pontine myelinolysis. और पेशेंट को क्या हो जाएगा? There is paralysis of all muscles except ocular muscles. So patient will have paralysis of all muscles, means हाथ पैर पूरे paralysis, quadriplegia. Except ocular muscles. तो क्या होगा आंसर? Is it malignant hyperthermia? Is it catatonia? No. So it is rapid sodium correction. Osmotic demyelination syndrome or central pontine myelolysis due to rapid correction of sodium. Then, okay, following is seen in meant to be syndrome. क्या था meant to be में? क्या क्या था बताओ? MTC था और Marfano diabetes. What else? Mucosal neuroma. What else? Pheochromocytoma. Megacolon. So cafe alert spots होंगे नहीं होंगे? Answer will be cafe alert spots, optic nerve glioma. These are seen in neurofibromatosis type 1, NF1 में होगा. So answer will be MTC, medullary thyroid carcinoma. Medullary thyroid carcinoma. Then medullary thyroid carcinoma. Clear? Am I clear? Okay, try to answer next one. ये मूव क्यों नहीं कर रहा? हैंग कर गए. ओके अभी दिख रहा है अभी? ओके नाउ ट्राई टू आंसर. 31. क्या होगा? अल्टर्ड सेंसोरियम ब्रेथलेसनेस हो गया ठीक है. हाइपोटेंशन ब्रेडिकार्डिया. Altered sensorium, breathlessness, hypotension, bradycardia, non-pitting edema. This is the biggest hint in the question. अगर पेशेंट को कार्डियोजेनिक शॉक होता है, any shock, it could be pitting edema. Now see, these are not feature of hyperthyroidism. These are feature of long-standing history of weight gain, constipation. So hyperthyroidism में क्या होता है? Weight loss, diarrhea, heat intolerance, amenorrhea. Is it clear? So this is a patient. Actual diagnosis will be mixed edema, comma. ऐसा कब होगा? When it will occur when patients stop taking medications. We call this mixed edema, comma. Expected question. Very, very important. Mixed edema, comma. Okay, try to answer next one. fatigue, prostration, known case of stable angina, blood is having a brownish hue. Actually, it's a pharmacology question. क्या होगा? What is the hint? Understand, if you see, whenever person is having long-standing history of angina or MI, patient must be taking nitrates. तो patient क्या ले रहा होगा यहाँ पर? देखो इधर, patient should be taking nitrates. And when you take nitrates for long duration, sometimes there is chance of methemoglobinemia. तो क्या हो सकता है उससे? उसका साइड इफेक्ट, इट कैन कॉज methemoglobinemia, and because of this, patients developing a brownish hue in blood. So it's actually a case of methemoglobinemia. Okay, this question is also a burning topic. बार बार पूछ रहे हैं. Now see, what tests we do for diagnosis and what tests we do for see the response to monitor the patient. So they're asking you to assess the success of treatment. Okay, tell me, endoscopy किसके लिए करते हैं? Endoscopy is used for diagnosis. IgG antibody study. How we do this? IgG antibody study. How we do for diagnosis or for what? It is an endoscopic based test. So again, we do this for diagnosis. Urea breath test. It is a simple card based test. तो इसको कब करते हैं? For prognosis. PXS prognosis. And urease test again. It is also endoscopic test. तो उसको भी कैसे करेंगे? Diagnose के लिए. So remember, invasive test we do for diagnosis. Invasive means आप एंडोस्कोप अंदर घुसा रहे हो. तो इन्वेजिव टेस्ट आर यूज फॉर डायग्नोसिस. पहली बार पेशेंट आएगा, फर्स्ट टाइम पेशेंट कमिंग, वी विल डू इन्वेजिव टेस्ट, एंडोस्कोपिक बेस्ड टेस्ट. एंड फॉर फॉलो अप you will do either rapid car test or stool sample, stool antigen test. इसलिए तो आंसर क्या होगा? यूरिया ब्रेथ टेस्ट. Just write down one line. Invasive tests are used for diagnosis. Invasive tests are used for diagnosis. Card-based tests like urea, rapid urea or urea breath test, and stool antigen test. So card, card-based, or I can say urea breath test. These are non-invasive. These are non-invasive, and these are done. These are done for follow-up. These are done for follow-up. Follow-up के लिए क्या करोगे? This test. Okay, try to answer next one. Following are signs of heart failure. What do you think? पहले बताओ. ये होगा कि नहीं होगा? हार्ट फेलियर का साइन है? नहीं है? नहीं है. Pulsatile is a sign. It is given non-pulsatile. This is not a sign. Pulsatile means episodic. You will see rise in JVP. हर time persistent नहीं रहेगा. So pulsatile rise in JVP. It is a sign of heart failure. Non-pulsatile is not a sign. Orthopnea होगा? होगा. Dyspnea after 2 hours of sleep. What we call this? PND. PND sign? Yes. Right upper quadrant pain होगा? बताओ. Is it a sign or not? यहाँ पर दर्द होता है. What we see, इसको बोलते हैं congestive hepatomegaly. Congestive और tender hepatomegaly. लीवर बढ़ रहा है because of congestion, and that is also a sign of heart failure. और आगे जाके क्या हो जाती है? Ascites. Ascites is also a sign of heart failure. So answer will be B, C, D, or I can say 2, 3, 4. 2, 3, 4. Done? Okay, तो easy है. बताओ, this one is easy. PHC में patient है. PHC में. HbA1c PHC में होता है. रैंडम से डायग्नोज करते हैं नहीं करते. तो PHC में क्या होता है? फास्टिंग एंड पोस्ट प्रेंडियल. 2 hours post glucose means post prandial. So fasting and post prandial means आंसर क्या होगा इसका? 2 and 4. 2 and 4. Clear? 2 and 4. Am I clear? Okay, I told you one more test for monitoring diabetes. Short term sugar indicator क्या था? Serum fructosamine. Long term HbA1c. Okay, try to answer next one. कोशिश करो उसको पहले. Try to answer this. क्या होगा? ध्यान से देखो क्या होगा. डायग्नोस क्या है? पेशेंट आया HIV का. पेशेंट इज HIV पॉजिटिव. फीवर, कफ एंड हेमेटाइटिस और AFB भी है. इट मीन्स इट इज HIV plus TB. Even nowadays, as per recent guidelines, all HIV patients should be tested for TB, and all TB patients should be tested for HIV. What is appropriate management? They are asking. Start ART. पहले क्या start करोगे? Why not ART? Reason? Tell me the reason. पहले क्या start करेंगे, ATT और ART? क्यों? Answer is correct, but reason is not valid. कैसे होगा? AR, ART start करते TB प्रोग्रेसिव हो जाएगा या TB कम्युनिकेबल हो जाए. कम्युनिकेबल तो पहले से है वो. ओके, अगर आपने पहले ART चालू कर दिया तो क्या होगा? क्यों? तो क्यों बढ़ेगा? TB और बढ़ेगा तो क्यों बढ़ेगा? क्या बोलते हैं उसको? हाई रिस्क. क्या होता है रिस्क? इम्यून रिकॉन्स्टिट्यूटिव इन्फ्लामेटरी सिंड्रोम. सपोज इफ यू स्टार्ट, अगर आपने पहले ART चालू कर दिया, एंटी रिट्रोवायरल थेरेपी, दैट विल इंक्रीज योर CD4 काउंट. CD4 काउंट बढ़ाएगी, देयर विल बी लॉट ऑफ साइटोकाइन रिलीज, एंड दीस साइटोकाइंस विल exacerbate TB. Is it clear? So ART will not start first. First will start ATT, and after 2 weeks you will start ART to prevent iris. Iris means immune reconstitutive inflammatory syndrome. So just remember, it is to prevent iris. 37 is an easy question, interesting question. Try to answer. बताइए क्या होगा? Sinusitis है, ulcerative lesion on nasopharynx, nodular lesions with cavitation on the lung, and renal failure. Following is most useful investigation. So first hint in the MCQC, I am highlighting the hints once again. Sinusitis means upper respiratory tract. Nasopharynx again, upper respiratory tract. Cavitation is classical feature in the lungs, means lower respiratory tract. Anal failure means you can see upper respiratory tract plus lower respiratory tract plus kidney involvement. So it's the case patient of Wegener's. So Wegener's का diagnose कैसे करोगे? How you will diagnose Wegener's? See Anka. So test for Anka. बाल you will do whenever we suspect sarcoidosis. AFB किसके लिए करते हैं? TB के लिए. Biopsy we can do in sarcoidosis again if we are suspecting sarcoidosis. So it's a patient of Wegener's. Wegener's में क्या करोगे? See Anka. बताओ क्या होगा आंसर? Try to answer the next one. Try to answer. क्या होगा बताओ? Easy है. During the discharge of COVID patient who was treated with steroid and remdesivir. So you are using remdesivir, it means it is not mild COVID, it is severe COVID. So आप उसकी छुट्टी कर रहे हो रेमडेसिविर और स्टेरॉइड देने के बाद फॉलोइंग यू विल इन्फॉर्म अबाउट हिम. बताओ. Repeat RT-PCR after 7 days? No. It will take minimum 14 to 21 days RT-PCR to become negative. So 7 दिन बाद कराने का कोई यूज नहीं है. वॉच फॉर persistent anosmia. पेशेंट को आप सलाह दोगे कि जब आपको सूंघना कम हो, then you should tell me, right? So that is again, this is correct. He should watch himself like he is having anosmia. Watch for headache and nasal discharge. This is advised. Glucose level check करना है या नहीं करना? Many of the patient they have become diabetic because they have taken a lot of steroid. तो glucose level भी monitor करना है. Sinusitis तो एक normal symptom है which you can see in any patient. So sinusitis is not that important. So 2, 3, 4. 2, 3, 4 will be the answer. Okay, now try to answer this. Correct statement choose करना है. NOAC or new oral or novel oral anticoagulant, they are used in treatment of moderate to severe MS. बताओ. देते हैं. MS में कोई रोल है NOAC का? एंटीकोगुलेंट्स कब देते हैं? व्हेन वी गिव एंटीकोगुलेंट्स. कब दोगे आप एंटीकोगुलेंट्स? बताओ. दे आर नॉट गिवन फॉर वल्वुलर हार्ट डिसीज, दे आर गिवन टू प्रिवेंट एम्बुलस. क्लियर? अगर कोई एम्बुलस की प्रोफाइलैक्सिस नहीं है पेशेंट को, इफ यू सी देयर इज नो एम्बुलस प्रोफाइलैक्सिस, देयर इज नो नीड, राइट? तो सिर्फ एमएस दिया हुआ है, एएफ नहीं है पेशेंट को, कहीं क्वेश्चन में एएफ मेंशन नहीं है, देयर इज पॉइंट ऑफ गिविंग नो. अगर एमएस है तो क्या करोगे? हाउ यू विल ट्रीट माइट्रल स्टेनोसिस? कैसे करोगे? balloon mitral valvotomy, right? So NOAC is not used here. Anticoagulants should be given in patient with ischemic stroke due to atrial fibrillation. अब atrial fibrillation से एम्बुलस बना, एम्बुलस reached where? In your brain. अब तो देना पड़ेगा. So here you have this. So this is the answer. NOACs are contraindicated in prosthetic valve. Actual question should be NOACs are yet to be studied. ये होनी चाहिए सही लाइन. So I will say it's a contradictory statement. नोवाक की रिसर्च अभी प्रोस्थेटिक वॉल्व में नहीं हुई है. All patients with atrial fibrillation who are not candidate for cardiac surgery can be started on बीटा ब्लॉकर. हर मरीज को आप बीटा ब्लॉकर दे सकते हो, ट्रू और फॉल्स? सीओपीडी का पेशेंट को बीटा ब्लॉकर दोगे? नो. इट इज नॉट द करेक्ट आंसर. इज क्लियर? सो एक्चुअल करेक्ट विल बी ओनली बी. ओनली बी ऑप्शन में नहीं है. So actually NOACs are not contraindicated, they are yet to be studied. So we will consider this also as a correct statement. So B and C means 1, 2, 3, 4. So 2, 3 will be correct. 2, 3 will be correct. Am I clear? Okay, बताओ. Easy one. Try to answer. This is very easy. When we call resistant hypertension, hypertension that is not responding to 3 or more different class of drug, that must include which diuretics? And thiazide is a diuretic. So answer will be diuretics. This is the definition of resistant hypertension. So resistant hypertension की definition क्या होती है? Hypertension which is not responding to 3 or more different class of drug that must include thiazide. Clear? Okay. 41. Here you will make some silly mistake. बताओ. तुम बताओ. बताओ बताओ. 100% oxygen, right? 10 to 12 लीटर 6 to 8 लीटर पे देंगे. नो. तो ऑल्टरनेटिव क्या लिखा था हमने नोट्स में? ऑल्टरनेटिव इज सबक्यूटेनियस सोमाट्रिप्टेन. हो गई सिली मिस्टेक. किस किस लोगों ने आंसर मार्क किया था ऑक्सीजन? सीधा नोट्स देख लो. नोट्स में क्या लिखा है? ओपन योर नोट्स व्हाट यू हैव रिटन इन क्लस्टर आईडी. एट 10 to 12 लीटर और अल्टरनेटिव विल बी 6 milligram subcutaneous somatropin. Answer is subcutaneous somatropin. Done. Okay, try to answer. Hemolytic anemia. Patients having dactylitis means swollen finger. Chest pain है. Hemoglobin is 5.6. Bilirubin is increased. So what do you think? Where you will see? In which anemia you will see dactylitis? Dactylitis हमने सिर्फ एक anemia पढ़ा था. कहाँ पर? Sickle cell anemia. So it's a patient of sickle cell anemia. It is not AIHA. It is not thalassemia. It is not intravascular hemolysis. Sickle cell anemia कैसा होता है? Extravascular. So it is a sickling crisis. So answer will be sickling crisis in sickle cell anemia. मैंने बताया था sickle cell anemia symptom like dactylitis, acute chest pain, priapism, osteomyelitis due to salmonella. So these are the symptoms. Okay, this one is easy. Hyperpigmentation over knuckles. Schilling test is abnormal and shows normalization with a short course of antibiotic. याद आ रहा है कुछ? Okay, let's understand this Schilling test. Even nowadays we don't use this test, लेकिन इससे बार बार क्वेश्चन आता है. समझो इसको. Schilling test you will do, and later on you will see excretion of B12 in urine. Schilling test हम step में करते हैं. Suppose there is Schilling test and this test is normalization. It is normalized. It is normalized after giving B12. अगर B12 देने के बाद नॉर्मलाइज हो गया, इट मीन्स इट इज अ वेजिटेरियन पेशेंट. समझ आया? इट मीन्स इट इज अ डाइटरी डेफिशिएंसी. आपने B12 दिया, नॉर्मल हो गया. सपोज B12 देने के बाद नॉर्मलाइज नहीं हुआ, पेशेंट इज टेलिंग यू आई एम अ नॉन वेजिटेरियन. तो नेक्स्ट टाइम व्हाट यू विल गिव B12 प्लस इंट्रिंसिक फैक्टर. एंड नाउ इट इज नॉर्मलाइज्ड. इट मीन्स इट इज अ पेशेंट ऑफ pernicious anemia. It means it is a patient of pernicious anemia. थर्ड थिंग अंडरस्टैंड, यू विल गिव B12 और B12 के साथ क्या दोगे? पैंक्रियाटिक एंजाइम्स लाइक काइमोट्रिप्सिन, ट्रिप्सिन, ट्रिप्सिनोजन. So when you give B12 plus pancreatic enzymes, then it is normalized. It means it's a patient of pancreatitis. Pancreatitis. Clear? अब उसके बाद क्या करोगे? Lastly, you will give B12, and with B12, what we give? A short course of antibiotic for 5 to 7 days. अगर एंटीबायोटिक देने के बाद वो ठीक हो गया, इट मीन्स देयर वाज सम ग्रोथ ऑफ बैक्टीरिया. उसको बोलते हैं बैक्टीरियल ओवरग्रोथ सिंड्रोम. बैक्टीरियल overgrowth syndrome. So this is how we perform Schilling test, and these are the four alternatives of MCQ that they can ask you. Is it clear? तो यहाँ पर क्या पूछा है? Is it Whipple disease? Whipple disease में तो हम Schilling test करते नहीं है. तो Schilling test का cause क्या है? Betel deficiency. In Schilling test we do in betel deficiency. तो Whipple disease में नहीं करते. Gluten enteropathy, celiac spro में नहीं करते. Tropicus spro में नहीं करते. It is bacterial overgrowth syndrome. Is it clear? Now some of you have marked the answer Whipple disease by saying hyperpigmentation over knuckles. अब देखो B12 की डेफिशिएंसी में भी यहाँ पे काले काले निशान पड़ जाते हैं. So hyperpigmentation of knuckles is also seen in B12 deficiency. Okay, try to answer next one. Cognitive decline is there. It means some sort of dementia. कुछ ना कुछ dementia तो है. Involuntary movement in both hands leading to difficulty in doing daily tasks. Involuntary movement means it could be chorea, but cog-vigility is found with bradykinesia. तो एक तरफ तो देखो कोरिया वाले फीचर, तो यहाँ से क्या लग रहा है? डिमेंशिया का फीचर. यहाँ से क्या लग रहा है? पार्किंसन का फीचर. So patient is having feature of Parkinson, Alzheimer as well as chorea. But now you can see MRI is having increased bicordate diameter. Alzheimer में क्या होगा MRI में? What you will see in Alzheimer? You will see cortical atrophy, and which is a normal change. In Parkinson also MRI is normal. So a disease where you will see mixed feature. कुछ Alzheimer वाले cognitive decline, some Parkinson feature, some chorea feature, and MRI is having increase in bicordate diameter. This is classically seen in Huntington disease. So Huntington में क्या होता है? Chorea. Is it clear? So see, Wilson disease can have secondary Parkinson disease, and Parkinson, Alzheimer will have अलग-अलग separate feature. Alzheimer will have dementia, Parkinson will have only tremors. तो क्वेश्चन में सबसे बड़ी हिंट क्या है? मिक्स फीचर है और एमआरआई इज हैविंग इंक्रीज बाइकॉर्डेट डायमीटर. दिस इज अ क्लासिकल चेंज व्हिच वी सी in a patient of Huntington disease. Even last year pathology question came. Huntington disease is due to mutation in which protein or due to increased activity of ubiquitin. Ubiquitin. CAG is repeat. You will see CAG repeat at chromosome 4. Answer will be Huntington disease. Done? Written? Okay, moving to next. बताओ. This is the best question of this paper. सबसे अच्छा क्वेश्चन है. Who will answer this? बताओ क्या आंसर होगा? Paper is easy, just you need to think. बताओ क्या आंसर होगा? तुम बताओ. What do you think? Not useful, which is not done. Okay, first tell me, Burkitt lymphoma is a high grade tumor or low grade tumor? It's a high grade tumor. So before starting chemotherapy, this chemotherapy can produce a side effect called tumor lysis syndrome. तो we know अगर आप पेशेंट को कीमोथेरेपी दोगे it can cause tumor lysis syndrome. What happen in tumor lysis syndrome? Tumor cell will break down and this content they will cause electrolyte imbalance. And I told you electrolyte में क्या होगा? कैल्शियम कम होगा और बाकी सब बढ़ेगा. बाकी सब में क्या क्या? बाकी सब में क्या क्या? Increase other means increase in sodium, increase in calcium तो कम है ना? Increase in phosphate. What else? Increase in uric acid, right? यूरिक एसिड बढ़ेगा, फॉस्फेट बढ़ेगा, सोडियम बढ़ेगा. Am I clear? Even potassium can also increase. Sometimes magnesium can also increase, but calcium कम होगा. समझ आया? तो अब देखो, इज नॉट यूजफुल. कैल्शियम कराओगे पेशेंट का? यस. पोटेशियम कराओगे कीमोथेरेपी देने से पहले? यस. यूरिक एसिड कराओगे? पीएच कराओगे? नहीं जरूरत है पीएच की. केमोथेरेपी विल नॉट कॉज एसिडोसिस और अल्कलोसिस. तो क्वेश्चन आपसे क्या पूछा था? ट्यूमर लाइसिस सिंड्रोम. So actual question was all are symptoms of tumor lysis syndrome except. तो याद रखना ट्यूमर लाइसिस सिंड्रोम में क्या होगा? कैल्शियम इज लेस, all other ions will be increased. Am I clear? Okay, try to answer next one. अगेन कुछ में मिस्टेक है. ये आईसी तो कुछ नहीं है, डीआईसी होना चाहिए. डीआईसी है. ओके, लेट्स सी द क्वेश्चन. पीटी बढ़ा हुआ है, पीटीटी बढ़ा हुआ है. इट मींस बोथ हैव इंक्रीज्ड. देयर इज इंक्रीज इन प्रोथ्रोम्बिन टाइम एंड इंक्रीज इन एपीटीटी. अब मुझे बताओ हैनॉक शॉलिन परपुरा में क्या बढ़ता है? पीटी एपीटीटी? दोनों ही नहीं बढ़ते. बोथ आर नॉर्मल. हियर बोथ आर नॉर्मल बिकॉज इट इज वस्कुलाइटिस. और फायरिया में क्या बढ़ेगा? अगेन दोनों नहीं बढ़ेंगे. आईटीपी, आईटीपी इज डिसऑर्डर ऑफ प्लेटलेट, तो यहाँ पर ब्लीडिंग टाइम बढ़ेगा. so it is DIC. In DIC you will see both are increased and platelets are consumed. तो कभी कभी क्या होगा? क्लॉट बनेंगे, कभी कभी ब्लीडिंग होगी. तो DIC patient can have even microthrombi as well as bleeding. Am I clear? Okay, DIC को diagnose कैसे करते हैं? What is the best test to diagnose? Okay, for screening what we do? D dimer. And for confirmation, we will do fibrin degraded product, FDP. For confirmation you will do FDP. So answer will be DIC. Simple. Okay, this question we have, this topic we have studied many times. 3-year-old child with steatorrhea means fatty stool, weight loss, and feature of malabsorption. So remember, in any malabsorption, we don't know, कुछ भी हो, celiac sprue, tropical sprue, Whipple disease or anything. Best test is always small intestine biopsy. समझ आया? कुछ भी माल अब्जॉर्प्शन हो, बेस्ट टेस्ट क्या होगा? कंफर्म के लिए क्या करोगे? बायोप्सी. तो सी म्यूकोसल सक्शन बायोप्सी नो. बायोप्सी कहाँ से चाहिए आपको? रेक्टम से नहीं चाहिए. वी नीड इंटेस्टाइन बायोप्सी. बेंडिक टेस्ट इज डन फॉर ओनली फॉर कार्बोहाइड्रेट माल अब्जॉर्प्शन. fecal elastase, again this is for elastase will digest elastin for protein malabsorption. Best test will be small intestine biopsy in any malabsorption syndrome. तो कभी कभी क्वेश्चन आता है सिलियक स्प्रू के नाम से. Okay, now try to answer. Okay, 68-year-old male admitted in ICU for exacerbation of COPD developed palpitation. अब suppose करो, I am a student, I am giving exam. I don't know anything about this question or this ECG, but I can see in ECG what I can see QRS कैसा है? Narrow. Narrow QRS, it means VT is not the answer. कहीं पर ST elevation दिख रहा है? There is no ST elevation, तो acute MI is not the answer. Is it clear? So answer is either atrial fibrillation or it is MAT. अब ये तीन चार एरो दिए हैं. So let me just zoom this arrow. You can see a normal P wave, then you can see an elongated P wave, then you can see again normal P wave, you can see inverted P wave. So more than three different type of P wave. P wave तो है ना? P wave है तो atrial fibrillation नहीं होगा. Simple. Suppose if you don't want to see this different, you can just see. आप सिर्फ इतना देखो P wave आपको दिख रहा है कि नहीं दिख रहा है. P wave है, it means it's not AF. Now what we have written in our notes is MAT patient will have history of COPD और sepsis. पेशेंट कहाँ होगा? COPD का होगा या सेप्सिस का होगा? आईसीयू में एडमिट होगा. एंड इन मैट व्हाट इज द ट्रीटमेंट? कैसे ठीक करोगे? विच एंटीएडमिक ड्रग यू विल गिव? क्या दोगे? एमियाडारोन, एबिटोलाइट, क्या दोगे? क्या दोगे? बताओ. विच एंटीएडमिक ड्रग यू विल गिव इन मैट? देयर इज नो रोल ऑफ एनी एंटीएडमिक. कोई भी एडमिक ड्रग्स नहीं देना है इसमें, अपने आप ठीक हो जाएगा ये. ट्रीट द सेप्सिस, ट्रीट द COPD, राइट? So answer will be MAT. Clear to everyone? Okay, try to answer. Again, I know ये सबका गलत हुआ होगा. 16-year-old with pain in calf for 2 days. 2 दिन से calf में pain हो रहा है. 5 days ago he had history of fever, sore throat, cough. Currently only pain on pressing the muscle. No sensory involvement, has normal deep tendon reflex. CPK is increased. CPK बढ़ा हुआ है. What is the probable diagnosis? Okay, now see. Let's see. Dermatomyositis will have some skin involvement and it's a disease of young female. यहाँ क्या दिया हुआ है? A teenager boy. तो डर्मेटोमायोसाइटिस कोई स्किन इन्वॉल्वमेंट नहीं है, रूल्ड आउट. गिलियन बारे सिंड्रोम में मसल में प्रॉब्लम नहीं होगी. गिलियन बारे सिंड्रोम इज न्यूरोपैथी. So CPK will be normal in GBS. GBS is ruled out. Duchenne muscular dystrophy is due to dystrophin mutation and generally this child is less than 10 years. 8-10 साल तक डेथ हो जाती है. तो क्वेश्चन विल बी डिफिकल्ट अगर क्वेश्चन में दिया होता बेकर मस्कुलर डिस्ट्रोफी. बेकर ऑप्शन में नहीं है, तो वी हैव टू रूल आउट दिस एंड वी हैव टू मार्क द आंसर वायरल मायोसाइटिस. Am I clear? So it could be either a case of BMD, बेकर मस्कुलर डिस्ट्रोफी. डुशीन बेकर में डिफरेंस क्या है? डुशीन की 10 साल तक डेथ हो जाती है, बेकर विल डाई बाय 20-25 ईयर. Otherwise, both are same. Baker is considered milder variant of Duchenne. Okay, try to understand this now. हमने कहीं पढ़ा था ये इस टाइप का इमेज? M spike we have studied. What is M spike? Okay, पहले इसको समझो. First spike you will see, it's called SPEP, serum protein electrophoresis. In serum protein electrophoresis, you will see first spike. This spike will be of albumin. Then you can see smaller spikes. तो जो पहली spike आई है, ये spike किसकी? This spike is of albumin, and these are other smaller spikes. These are of different immunoglobulins. For example, let me say this is the spikes of IgM, It is spikes of IgG, IgE, or IgA, etc. Am I clear? So this is called normal SPP, normal serum protein electrophoresis. समझ आया? What I told you in multiple myeloma, you will see first spike will be of albumin. Then you will see second spike, which is slightly shorter than M spike. बाकी सब स्पाइक नॉर्मल होगी, लेकिन एक और स्पाइक दिखेगी. So this is the spike of albumin, and this spike you will see one more spike, and this spike you will see where this spike is called M spike. और ये स्पाइक किससे छोटी होगी? एल्बुमिन से थोड़ी छोटी होगी. And this spike you will see in which area? IgG area, or sometime you will see this where in IgA area. So this is the pattern you will see. इसको बोलते हैं church spire pattern, and it is seen in multiple myeloma. समझ आ गया? समझ आ गया इतना? अब इसमें देखो आपको क्या दिख रहा है. ब्लैक एरोज आर नॉर्मल. तो पहले मैं नॉर्मल को शेड कर रहा हूँ विद द ग्रीन पेन, बिकॉज हमने ग्रीन से नॉर्मल बनाया, तो आई एम मेकिंग नॉर्मल. दिस इज नॉर्मल. किसकी स्पाइक है ये वाली? द स्पाइक विल बी ऑफ albumin. Then you can see this is the normal spike. Clear? जो हमने बनाया सेम वैसे तो नॉर्मल है, ऑलमोस्ट सेम. कंपेयर दिस एंड दिस, these both are same what we made. बट रेड में क्या है? एबनॉर्मल. व्हाट यू कैन सी, रेड में आपको क्या दिख रहा है? विद द रेड व्हाट यू कैन सी? लेट्स सी, लेट्स मेक इट ब्लू. व्हाट यू कैन सी? एल्बुमिन का स्पाइक छोटा हो गया, एंड अल्फा वन अल्फा टू में स्पाइक बड़ा आ गया थोड़ा सा. तो एल्बुमिन का स्पाइक कम हो गया, इट मीन्स बॉडी में एल्बुमिन का लॉस हो गया. तो क्या ये मल्टीपल माइलोमा है? नहीं है. एल्बुमिन का लॉस कहाँ होता है? नेफ्रोटिक सिंड्रोम, प्रोटीनूरिया, सिंपल लॉजिक. टीबी, लिवर सिरोसिस में तो कोई स्पाइक ही नहीं. सो एल्बुमिन बेसिकली इस क्वेश्चन में क्या कम हो रहा है? एल्बुमिन्स आर इंक्रीज्ड एंड अल्फा वन अल्फा टू ग्लोबुलिन्स आर इंक्रीज. इट मीन्स एल्बुमिनूरिया, और एल्बुमिनूरिया कहाँ होगा? नेफ्रोटिक सिंड्रोम. That is seen in very late stages in cirrhosis, and cirrhosis will have decreased albumin, but there is no increase in these globulins. Cirrhosis will not have this increase in globulins. Nephrotic syndrome like minimal change disease, उसमें क्या होता है? Only albumin is gone. Selective microalbuminuria, later on macroalbuminuria. So it is actually a patient of MCD, minimal change disease, and that is the type of nephrotic syndrome. Am I clear? So आपको SPEP का क्वेश्चन में ये तीन पैटर्न याद रखने. यू हैव टू नो दिस थ्री पैटर्न. एल्बुमिन कम हो रहा है, नेफ्रोटिक. एम स्पाइक आ रही है, मल्टीपल माइलोमा. और समटाइम दे कैन आस्क यू नॉर्मल SPEP. Done? Okay, then take a break. We'll continue after the break with the next 50 questions.